The new vaccine advisory panel for the Centers for Disease Control and Prevention postponed a much-awaited vote on RSV vaccines today. The vote is now expected to take place tomorrow. Today was the committee's first meeting since Secretary of Health and Human Services Robert F. Kennedy Jr. replaced all of its members with his own appointees. CBS News health reporter Alex Tin joins us now. Alex, thanks for being with us. Why do you think this vote was postponed?
Yeah, I mean, to put it, if you were watching the meeting today, it was clear to anyone watching that the meeting was not going to end in time today to have that vote on RSV immunizations by the end of the time that they were essentially going to be kicked out of the room. So that vote has been postponed until tomorrow. And the reason that those meetings went so far over time is because you had a lot of questions, a lot of extended questions from these new vaccine advisors picked by RFK Jr. to the CDC officials who usually run these meetings, questioning everything from the basics of how they do their jobs all the way up to very complicated questions about immunology and their, often unfounded concerns about vaccine safety and vaccine efficacy that officials essentially had to spend time rebutting.
Well, on that note, the panel is also breaking with precedent and plans to review the childhood vaccine schedule, something that's been in place for decades. What could that mean?
Yeah, well, what we heard from Martin Kulldorff, that's the new chair of the CDC's Advisory Committee on Immunization Practices, is that there's two specific targets they're considering changing as a result of that review already. The first that they're considering changing is the recommendation for hepatitis B vaccines that are given early in life. And the second part he said they're considering changing is measles vaccines that are given early in life. But Kulldorff was clear, it's not just those two vaccines. They're looking at what they fear is the quote, cumulative effect of all of the vaccines that are given during childhood. Those are just the first two of the targets they're thinking of looking at.
And Alex, we understand you have new reporting on the CDC hiring the former head of an anti-vaccine group. What more can you tell us on that front?
Yeah, that's right. The nominee for CDC Director, Susan Menars, was up on the Hill today. She faced a lot of questions about the ACIP, including concerns that this person, Lynn Redwood, the former head of Children's Health Defense, that's the anti-vaccine nonprofit that Robert F. Kennedy Jr. founded before he became the nation's health secretary, that Lynn Redwood was presenting to the panel tomorrow. There were a lot of concerns about that. We're told now by CDC officials that Redwood isn't just presenting to the committee tomorrow. She has been hired to be working within the agency's Immunization Safety Office. That's the part of the CDC that's responsible for the studies that show that vaccines are safe, as well as for communicating the results of those studies.
Alex Tin, thank you very much. We appreciate you.
Thank you.